Hi, I'm Dr. Schwartz. I'm owner-operator of Piedmont Physical Medicine and Rehabilitation in Greenville, South Carolina.
Dr. Schwartz, tell us a little bit about what you do here at your facility.
I specialize in complex chronic pain and regenerative medicine and peripheral vascular medicine. We take people that are looking for non-operative care for joint replacement or arthritis or tendon problems or sports injuries, and we offer them regenerative, non-surgical regenerative techniques. At the same time, we treat patients with complex chronic pain problems, people with weather-sensitive pain, fibromyalgia, back pain, neck pain, migraines, people that have chronic medical problems that are complicated with other medical conditions.
Awesome. And would you tell us a little bit about what you've been doing today? We've seen a lot of people that have gone to a lot of doctors and never found a cure or never found anything to relieve their pain. So will you just tell us a little bit about those folks and what you're doing for them?
Today we spent time in particular on two procedures called PRP and Stem Cell. PRP stands for platelet-rich plasma. Platelet-rich plasma is when we take about this much blood out of your arm, we spin it down to about this much, and what's left is your growth factors. So we concentrate your growth factors and we put them in the wounded area. So for example, maybe in a tendon, that might be bad for tennis elbow or golfer's elbow, or for a rotator cuff, or for a strained or stretched ligament in a knee or an ankle. Stem cell is much more complicated. In this case, we basically are doing liposuction, or we're drawing blood from your hip, and we're concentrating the most immature cells, those cells that we call stem cells that can differentiate or grow into the actual tissue that we want to place them into. And we do that more for people that have bad arthritic joints with joint space narrowing. So today we've done a few cases of stem cell and a few cases of PRP.
Awesome. And tell us a little bit people's misconception about stem cell and what the truth really is.
Well, I want to think that what we're trying to get at is there's more than one kind of stem cell. Several years ago, there was a national controversy as to whether or not we should be doing research on stem cell. That was embryonic stem cell. This is not embryonic stem cell, and this is not injecting or taking the stem cells from someone else. This is your own stem cells. These are adult stem cells, completely outside of that controversy. And there's quite a bit of medical literature supporting its use in these applications today. One of the things besides joint replacements that we did a case on today that I was really very excited about is injecting the PRP into someone's calf to help regenerate and regrow blood flow. Really a very effective technique we found for neuropathy pain, peripheral vascular disease as well. Our approach is a little bit different. We try to treat the source, not just the symptom. We're very holistic in our nature, so we don't just treat a joint. You know, you may have tight muscles surrounding the joint, you may have nerve damage in your back that's making your knee tight, you may have difficulty with walking because you have poor balance problems. We want to correct your nutrition, we want to correct blood flow, we want to make sure your immune system's not part of the problem. We like to take a holistic approach. Now that doesn't mean that everybody needs everything. We have plenty of people that come in here that say, you know, I'm an athlete and I just need my elbow fixed because I got to go play racquetball next week in a tournament. And that's what we do. But there's other people that have a lot of problems. There's not one singular source for their problem. I'm willing to, in fact I enjoy, taking the time and sorting all that out and trying to find the right tool for the right patient at the right time. And that's really what makes the difference. It's not being so much inside the box that you can only do one thing, but looking at the whole person and doing what they need to get them well.
And I want to talk to you a little bit about RSD. Can you just kind of tell people what RSD is, what some of these people are experiencing, what a lot of doctors don't realize how much pain they are really going through, and what you're doing to help these folks?
The best way to think of RSD, or reflex sympathetic dystrophy, is to think of people that have weather-sensitive pain. So at the easiest or the lowest component of it, we suggest thinking of a sprained ankle. When you sprain an ankle, a lot of people will say, I felt a sharp pain, but then it burnt. That burning, chronic, burning, swollen, bluish discoloration pain, well, we don't know. We just thought, well, I don't know. It's not a sensory nerve. It's not a motor nerve. It didn't make me feel. It's not what makes me move. It's the sympathetic nerve. And sometimes that nerve, like a car that's dieseling or won't shut off, it goes nutty. And we call that dystrophy, reflex sympathetic dystrophy. By reflex, the sympathetic nerve goes nutty. So think of a car engine where you've got the key in your hand, but the engine is still knocking, it's still running. And when that happens, that nerve decreases blood flow to the area, and it causes burning pain, and it causes excessive pain to non-painful stimulus, and it causes skin color changes and sweating changes. But in its mildest forms, people just say, I hurt, and the weather hurts me, and it bothers me, and I don't like anything touching me. In its more severe forms, you can lose bone and muscle and loss of motion.
So what are you doing for these people? I mean, some of these folks can't walk, correct? They can't get out of bed?
Yeah, we've had, fortunately, several cases recently where we've got them walking again that they can't wait there. They can't even lift the sheets on their bed. It hurts too much. So first is we try to map out or prove or validate that they have the dystrophy, and we use a test for that called thermography. And when we put that under cold stress or put them in a cold environment, we measure their skin temperature, and we find that their skin temperature regulation isn't normal. So you don't expect to take a hot glass of water, put it in the refrigerator, and think, well, one half's going to get hot and the other half's going to get cold. You expect it to equilibrate. We expect people to do the same thing. And if they don't, we can map and we can measure where that skin temperature abnormality is. And by looking at the picture or the map that the skin temperature abnormality is in, we can determine what's generating that sympathetic response. So first thing is we validate the complaint. Second thing we do is we try to prove what's causing the complaint. Next thing we do is we try to block the sympathetic nerve from dieseling and then go ahead and repair the underlying source that's generating it.
Wonderful. And is there anything that you want to tell folks that are experiencing chronic pain that think there's no hope?
It's really up to you. Patients have to take ownership in their own bodies. If you're not getting the answers you want, you need to go on the internet, you need to read, you need to learn, you need to keep seeking. A lot of people think, well, if I can't see it, it's not there. Well, it's just not true. You've got to expand that thinking a little bit. So, for example, if you have static on your cell phone, well, I can take a photograph of the cell phone. I'm not going to see the static. Think of that like an MRI or an X-ray or CT. Somebody can say, well, my X-rays or MRI is normal. Well, that doesn't mean it's working properly or that the physiology is proper. So take some ownership in it as much as you can. Take control of it where you get into a partnership with your provider, with your physician, so that it's a shared decision-making model, and just keep looking. That doesn't mean that you should be having unrealistic expectations. You have to have realistic expectations, but you need to be part of the process at the same time.
Awesome. And how far you've got patients all over the country? You've seen someone come in today from 600 miles away. So tell us a little bit about that. You have patients. You're not just a local doctor, I guess is what I'm trying to get at. You have patients from all over the place.
Well, we're blessed. The farthest patient we've had has come from Beijing. We've had people come from the U.S. Marshall Islands. We have people from the Netherlands. And then we have people that travel from the United States. And of course, like you would expect, those that can travel and that can get to and fro within a day's time or that are local, of course, make up the majority of our patients. But we are blessed to have patients that travel and they spend time here because they want to get better, and fortunately the results have spoken for themselves.
And if they want to learn more about you and your practice and your teachings, what website can they check out?
Please feel free to log on to our office website, Piedmont, PMR.com. And on Piedmont, PMR.com, you'll also find that there's a little area there called Email Us for safe mail. It's a encrypted email. If you email me, I'll always email you back. It may take me a day or two. It should be a non-urgent question, but we do get back to you, and we welcome your questions.